Hi everyone, we're back at Break the Stigma with Shirley Ross today. Thank you so much, Shirley, for joining us.
You're welcome.
So we're just going to start a little bit at the beginning about just telling us a little bit about yourself and what you do.
Yeah, well, I'm 67 and I'm retired. I've been retired for about 6 years. I was a registered nurse at the beginning of my career, and then I became well, during that period of time, I worked doing community development as well. And then I worked at Oxfam Canada, which is a non-governmental organization. And I spent the last 20 years before I retired doing communications work for the BC Nurses Union. I have a daughter who's 37 and a granddaughter who's turning 3 in July, and a husband, not my first, but my second husband. And we've been together we've been married almost 30 years. It'll be 30 years this year. I'm involved in a lot of volunteer projects, and I do a number of different crafts as well. And yeah, in terms of hobbies. And yeah, so that's a little bit of my background. I can tell you more as we get into the interview.
Yeah, sounds good. I'm excited. You're going to bring such a different perspective here by being a nurse, being a mother, being involved with volunteerism and everything else. So I'm excited for that. So I guess we'll just get right into it. Can you tell us a little bit about your relationship with mental health and what it means to you?
Yeah, so I grew up in an interesting family dynamic. Well, I won't get into all the details of that, but what happened when I was I think I was about 6 or 7. My mom suffered from severe depression. I mean, I didn't understand it at that time, but she suffered from severe depression. And she ended being hospitalized for a number of months. I went to live with my aunt. And I found out in the future that she had a lot of ECT treatments, electric shock treatments, to deal with her depression. So I think that never really, like back then, that's all there really was. I mean, obviously, there were also in that era experimenting with psychedelic drugs as well. I mean, not by anybody's will, but she spent I wish I could remember exactly how long, a long time in the hospital. And when she came home, she was never really herself, like, ever again. So I think, that was very detrimental to me, because 2 years later, when I was 9, my father passed away suddenly at a very young age. So my mom became a single mom. She had to go back to work, and she hadn't worked during my younger years. So I was left not really alone, but intentional. I mean, I had neighbors who would feed me and blah, blah, blah. But she had to work a lot in order for us to survive.
Yeah.
And we also, at that time, shortly thereafter, had to move out of my family home, which is a long story and I'm not going to get into. But so I was uprooted from my community and had to go live with my mom in a 1-bedroom apartment. So, and we lived like that until I was 16. So my formative years were very distraught with a lot of grief and suffering and a lot of anxiety because of what had happened. Like, I always thought when my mom came home and my dad had passed away that my mom would die as well. So I think for me, I started developing at a very, well, even younger than that, young age. I suffered from quite severe OCD as a young person, which I eventually was able, through counseling and other methods, through cognitive behavioral therapy and just plain counseling and my own kind of journey with doing my own self-care, was able to kind of overcome that part of my experience in my youth But I've always had anxiety. So I've suffered from anxiety from a young age, and I still have anxiety today.
Mhm.
I don't see anybody about that. I do take medications for the anxiety, which are helpful, but as we know, addictive, and they're kind of a long, I've been on them for a long time. So it's not something that I'm going to wean myself from at any time in the near future. So
Mhm.
that's a little bit of my history. And then I became a single mom
Mhm.
by choice. So that was my firm decision.
Mhm.
And that said, it was, it was very, very challenging to work, be a mom, and my daughter had some issues growing up for sure. Luckily, I met my husband when she was 7, so he became a kind of a very focused. He was more focused than I was for sure. Even though I had a career and I was busy, he was very grounded and a very stable presence, and so that really helped over the years. But as time went on, I had a family member who did develop, I would say, moderate mental health issues in their teenage years. And back then, it was very challenging to find, it wasn't hard to find a psychiatrist. It was very hard to find the right kind of counseling, and it was very limited. This person ended up going to Children's Hospital, but it was a real struggle to get them into that facility and, encourage them to keep on with it. Um, that was a short-term solution. It was only for a period of time. And then I helped them finding resources in the community, which was next to impossible for anybody under the age of 19. It was very challenging. And
Yeah.
we're talking, 15 to 20 years ago. I think that's the case now. I think it's still a big challenge as well. So, and all through my life, I've had individuals, my friends, everybody I know has some kind of, I wouldn't call them mental health issue, but some kind of issue that affects their ability to function on a daily basis in some ways. So I think especially, the last 2 years during COVID, I think there's been more and more of that. And I've found a lot of my acquaintances and friends have been very distressed about life, and especially at my age, it's, longevity and all of that. So
Mm.
so I'm going to take a break and let you continue with the questioning while I take a sip of water.
Yeah, no, thank you so much for sharing all of that.
Yeah,
It's
no
so
problem.
insightful. You have so many experiences, hardships, but also triumphs. Triumph is triumphant.
Hmm.
um,
Triumphs. Yeah. Yeah.
during
Yeah.
that journey. And yeah, thank you for sharing all of that. In
No
terms of
problem.
the resources, do you think that there's a shortage of professionals in the area, or what do you think is the main barrier for
Well,
access?
I think everything is siloed a lot. So it's like you have to either have a good healthcare plan, or you have to have money in order to find the right kind of counseling that you need. Um, and that's a challenge for many people that I know that are suffering, that would benefit from some kind of guidance, but they just don't have the resources for it. So the mental health teams, of which there aren't that many left, are pretty stretched, and trying to find community resources, unless you're dual diagnosis, or you've been arrested, or you've ended up in the hospital. Like, it's just very hard. And I have a friend whose daughter was actually in emerge, I guess about 2 months ago,
Mm.
who suffers from a lot of mental health issues, and also physical issues. So she was in because of her physical issues, but because she has mental health issues, she really needed to be treated in hospital. And they sent her home because um, they already assumed she was connected to certain resources in the community, But that wasn't the case. She has agoraphobia, so she doesn't go out of the house. So she can't get to appointments. There's nobody that can go in and visit her. So, like, services have to move from having, the person who's affected by whatever going to see somebody. It has to be more open than that. And, COVID's allowed a lot of communication online, which has been great, but it's not like seeing somebody in person and having that connection, which is it's in a very different way than what we're doing right now.
Mhm.
You can share a lot, but you can't really get to, some of the deep dives that are necessary to really help somebody.
Mhm.
And when I did CBT, it cost me a fortune. Luckily, I've had a great career and I have the resources, and my husband has a good job, but that's not covered. And, it was expensive. I was committed to do it, but and it takes a long period of time. It's not a short term. There's nothing that's short term. Everything takes time. But I think that for me, that was the one thing that really helped me. And that was not that long ago, in overcoming a lot of other issues that I was dealing with. So not the stuff from my past, really, but more just anxiety and stress in general.
Mhm.
And I think there's a lot of anxiety and stress in the world today
Mhm.
from all different reasons, all different factors, like COVID, Ukraine, environment, whatever. We're all dealing with stress in some way.
Absolutely. Yeah, there
Mhm.
is such a shortage in resources, but also a lack of accessibility that really needs to be dealt with. Um,
Mhm.
and
Uh,
yeah, COVID did offer a silver lining in that there is that telemedicine aspect now, but you're right, it isn't the same feel as being in the same room and
Yeah.
having that
Yeah.
intimate connection.
Yeah.
Yeah.
Yeah. I mean, it's been really great for lots of people that I know.
Mhm.
They've used those resources, and even just online, there's more. I think the good thing is there's actually more online resources that are legitimate for different methodologies of treating mental health issues. So you can try different things. You can try different things online, but again, you need to be computer savvy. You need to have a computer, and you need to be internally able to take the first step to do that. Which is, I also know another young person who's transitioning,
Mhm.
and she just can't get it to, and she's not that young, she's in her early 20s, but she just can't get it together to even call or even email someone to make an appointment. So it's not the panacea that it should be, because there are people like my other friend's daughter and the person I'm talking about right now that are just very isolated, and they just don't have the capacity to take that first step, which is so crucial. So I just think there needs to be more teams of individuals that can go out and actually, I know during COVID that's been impossible, but teams that could actually go and monitor people. I know the police can do wellness checks and that kind of thing, but I meant more in-depth monitoring.
Yeah, and
Yeah.
people who have the expertise to help in terms of their health.
Yeah.
Get
Yeah.
on that, absolutely.
Yeah. Because, I don't think, any, I shouldn't say anybody because I don't know that, but for me, like, I don't have like severe mental health issues. I have anxiety, but it does affect stress. It does affect, my body in many ways has been affected by a combination of that. So I have ended up, for whatever reason, other chronic illnesses, that may be related to stress, may be related to my anxiety, but I just think they've been contributing factors to what's going on on my body now that I'm a senior.
Yeah, I mean, absolutely. It's all connected, the
Yeah.
mind and
Yeah.
body, so
Mhm.
it would make sense.
Mhm.
So I want to go into a little bit about how you're expressing that it's really hard for people to take that first step to ask for help or to send that email, to
Mhm.
tackle their mental health journey. Do
Mhm.
you think that stigma plays a component in that? And how do you suppose that someone
Yeah.
takes that first step?
I think stigma does for sure. And everybody in my world knows that I suffer from anxiety, and some of them know my upbringing, not everybody. But I just think, people don't want to know like people don't want to declare to other people that they have a problem. They
Mhm.
think that they can cope on their own, or they're just so traumatized. And I think trauma plays a big part of this. Like, if you suffered from trauma, I mean, my trauma was, moderate. I mean, I'm claiming it as moderate. Maybe other people would see it as severe trauma, but I wasn't emotionally abused. I wasn't sexually abused. I wasn't traumatized in those ways.
Mhm.
So, I just think like we need more trauma informed care everywhere. So not just dealing with, as you say, mental health journey. I shouldn't call it issues, but your mental health journey, but your physical journey too, because physicians don't have, I know you're going to be one, but they don't have that training in what trauma informed care really is, and especially for um, uh, people of color or BIPOC people, like in general, it's really limited, or Indigenous people. Like I think the healthcare system does them a disservice, and I think there needs to be more training to make sure that that's part of your assessment of the individual that's coming to see you about whatever. Because I've heard stories of individuals going to see their doctor about an ailment, but really they've gone to see their doctor about the trauma that they experienced in their youth or teenage years or whatever. So,
Mhm.
um, so I just think that's really good. And I know that doesn't answer the question about stigma, but yes, there is a stigma. And, I'm not going to tell everybody in my life that I have issues, that I had issues, or my upbringing. But I've had enough internal resources to do something about it. But
Mhm.
I think youth today are really vulnerable. And I think, as I've already mentioned, um, people with diversity are very like really at a disadvantage as compared to other people.
Mhm. Yeah, thankfully from the medical side, and I haven't been in medical school very long, but we've already had some trauma informed
Great.
education sessions, which is wonderful.
That's
Um,
great.
but of course, that's a new addition, and there's lots of
Hmm.
work to be done and a lot of education to be had.
Hmm.
And I've heard some already inspiring stories from my colleagues in that they've had a patient come in and the patient says they came in for this particular reason, and then they're kind of sitting in silence for a little, and then all of a sudden they just break down and open up. So I think there is that communication to a certain extent, but definitely a lot of work to be done there.
Yeah, well, that's really encouraging to hear. I just think it's, some of the older docs, and yeah, and I used to be a nurses as well. Like, we never got any training about that at all. And I mean, that was years ago, but I don't even think, I mean, in nursing school, it's probably a little bit different now.
Mhm.
But, I don't know for certain, but I know that if we look at, some of the reports that have come out, particularly around Indigenous peoples, that the healthcare system has failed them miserably
Mhm.
in lots of areas, including their mental health journey for sure.
Yeah,
So
that's a
yeah,
whole other discussion.
yeah. But it's hard to come out and share that, that you're suffering. It really is hard for people to do
Absolutely.
that. Yeah.
Absolutely.
Mm.
Well, yeah, the whole medical side is definitely another issue. But what do you think that all of us can do on an individual basis, day to day, to help reduce that stigma and open that dialogue around mental health?
Well, I think talking about it more. I mean, there's a lot of if you are on social media, it's easy to find different groups that are set up to kind of walk you through that. There's, I think there's a lot of public messaging going out now around mental health issues, and there's a lot of different days that have been proclaimed to deal with mental health. So it's out there. It's just, pointing people in the right direction. Um, and just trying to tell people that it's really safe to disclose information to their practitioner, whoever that might be.
Yeah.
Yeah.
Yeah, definitely easier said than done sometimes.
Yeah.
Do you remember that moment that enabled you to take the first step?
um I don't, but I suffered from particularly OCD until really my late 20s. But
Mhm,
I never, and that was around the time where I started to do some counseling. I don't think I did any counseling before that. I can't remember like real counseling
mhm,
before that. And doing a lot of family of origin work before I really understood. And a lot of, I had, you know, I was on a trajectory to do my career and raise my child, and I was doing a great job. And, and the stuff from the past was irrelevant. And so, but it wasn't. So it took a long time to figure out that a lot of my issues were, I was traumatized from them at a young age,
mhm.
and obviously, some of my behaviors were because of that. So, yeah, I think it's some people can recognize that earlier, and some people they don't recognize that at all. So, but I can't remember an exact
No,
time
that's okay.
or a moment or I don't really know. I can't recall
No,
that,
that's okay. That's
which
okay.
is probably a good thing.
Yeah.
Yeah.
Yeah. Yeah. I mean, you've clearly progressed to where you are today. And I hope
Hmm.
everyone else is as inspired by
Hmm.
you facing your past and being
Yeah.
courageous to work through some of those maybe unprocessed emotions to arrive to where you are today.
Yeah. Well, that's really important. I don't think anybody that's on a mental health journey doesn't have something in their past that's a trigger for them. And pardon me, and unless you can claim that and work through that, then you're not going to make any progress. Like denial doesn't really help at all.
Mhm.
So I'm just lucky that I had the wherewithal and resources to kind of move forward around those issues. And I was also talking to my sister, who grew up in that environment. She's a lot older than I am, so she wasn't around for all of it.
Mhm.
And then, it was, and, a lot of it happened after my mother passed away, which was quite a long time ago. Um, that all that came out more so than before. But I knew that when I would visit. I mean, I knew for a long time as a young adult that she suffered a lot from depression. I mean, I knew all about that. And certainly I was already in nursing school. And so, I knew my mom was different.
Yeah,
And she was a I mean, she was a great person. But she had her moments where she just, couldn't move forward on certain things. And that was tough. Yeah.
absolutely.
Yeah.
Absolutely. And especially growing up where you expect a certain type
Yeah,
of
I ended up caring for my mom like as a teenager. I shouldn't say more than she cared for me, but like I had to do a lot for her. And yet she she worked full time. She
Mhm,
brought in resources. We weren't terribly poor. We didn't have a lot of money, but
mhm,
there was always food. Like we had housing and food and all
mhm,
the basic stuff. And but that tapped her out. That was about it. So in terms of coming to like my school events or things like that, like that never happened. And when I was I guess when I was about 16, 15 or 16, I can't quite recall, she had a serious car accident and ended up in hospital for a year. So then I had to, and I wasn't allowed to stay on my own. Because I was very self-reliant and self-sufficient, and I was forced to go live with my sister in an environment with her husband at that time, who was um, emotionally and physically abusive, not to me, but I mean, he did yell at me a few times. And I just finally said to my mom, like, I can't stay there. And I said to my sister, I'm going home to my, my apartment. I can manage. So, and then when she came home, she had a body cast, which they don't do very much of anymore. But so I had to bathe her, and like I had to do everything for quite a long period of time till she recovered. And
Wow.
yeah, so that was also that added to my stress for sure.
Absolutely.
And I don't have any regrets about doing that. I'm
Yeah.
really glad that I could do that for her. And now as an adult, but thinking back on my teenagehood, it wasn't quite what I imagined it to be. Yeah.
Yeah, absolutely. I mean, that's so
Yeah.
much to go through at such a young
Mm,
age.
yeah. So that's, yeah. Yeah.
Did your
Yeah.
perception of mental health during motherhood change when you yourself became a mom?
Um, did it change? It didn't. My focus was on doing a really good job as a mother. And my daughter and I have the best relationship you could ever wish for. Like,
Mhm.
we talk every day, we do things together all the time.
Mm.
We've been, kind of like best friends forever, which I know maybe sounds weird, but
Oh, that's
so
wonderful.
my focus, like, I think if you're, I just had to focus on being a mom. And
Mhm.
then my career was also critically important for me, because at some point, and it was after, pardon me, after she was about 5, no, she was about 5, I went back to university. As soon as she could go to school, kindergarten, I went back to university full time. So I was at university for 2 years full time.
Oh my God.
Maybe not the best time, but so I was like going to do this, and I was going to be the best mom, and and all of that was hard, and but I did it. So I think I have a lot of resiliency, and I
Mm.
have to keep reminding myself, now that I'm a little bit older, that that resiliency is still here. And now that I have some health issues, that your mind can actually make how you think about your body and yourself makes a huge difference. So I mean, that comes into play too. It's having those positive messages wherever you're getting them from, makes a huge difference in trying to shift things for people too.
Mhm.
Yeah.
Absolutely.
But so I didn't really answer your question, because you know, I was just determined. Like, I was such a determined individual. I was 30 when I had my daughter. I was just like, okay, this is what I've chosen. This is what I'm going to do. But I also want a new career, and we're going to do this. And I had it all mapped out, and I had saved money before I got pregnant. So I had like a whole set of values in my head about how things were going to be. And it actually turned out that way. So I was very fortunate, for
Mm.
sure.
I
Pardon
mean,
me.
it sounds like she's so lucky to have you, and it sounds like
I
you guys
hope
have.
so.
No, I'm sure it's true, and you have a wonderful
She's
relationship.
very thankful. I mean, she's married, and as I said, I have a granddaughter, and
Oh,
she's a teacher, and she doesn't work full time right now. But
yeah.
yeah, so we're as close as can be. And
Mhm.
I don't know how, like, I do know how that happened, but it was just a lot of support, and I got it. Like, I didn't get a lot of that growing up, so I
Mhm.
knew exactly what she needed during different phases of her life.
Yeah.
And I was just determined that that's what I was going to do. Did I sacrifice some things for me? Oh yeah, for sure, definitely.
I
Yeah,
mean, every
I
mother should.
think mothers do that I think I do that even now, but willingly. I do that willingly. Yeah.
Mhm.
Yeah.
No, yeah, thank you for sharing all about that relationship. I just
Hmm.
have one more question for you
Yeah.
before we wrap
Yeah.
up a little bit.
Yeah.
You said that there was a switch in your mindset about being kind to yourself and being kind to your body and your mind. And I think that is easier said than done sometimes because there can
Mhm,
be a negative narrative
mhm,
that loops
mhm,
around in your head. And partially, I think that does come from stigma and having that
mhm.
stigma towards yourself, external
Yeah.
stigma feeding that. So, what was that switch, or can you elaborate a little bit on how to do that or how you did that?
Well, yeah, self-care has not really been my forte forever. And when I did the CBT, I was a lot older.
Mhm,
Um, and I did that because my workplace was driving me crazy.
mhm,
And I was starting to develop other really weird behaviors that were not healthy.
mhm.
So I lost your question just thinking about that. So I did that, and then from that, I learned, I really worked hard at the methodology around CBT, and
Mhm.
I practiced that for a long period of time. Then, it didn't, I let it go. And then I just figured out my own self-care, like what works for me.
Mhm,
So I do meditation every day.
mhm.
I do modified yoga for me because I have some back issues.
Mhm.
I do walking meditation.
Okay.
Um, I've done tapping. I don't know if you know about tapping, but I've
You.
I've used tapping, not so much now, but in the past. It really does work. It's quite interesting how it can work.
Fascinating. Yeah.
I've started some new hobbies which take you out of your head. Um, and so you really aren't thinking about anything else except what you're doing.
Mhm.
And I became a jeweler like years ago. I make jewelry. And so that was also a distraction. I can't do that so much anymore because of my back, but
Mhm.
I'm still considering myself a novice jeweler, and I tried to sell stuff online and blah blah blah.
Yeah.
But yeah, and just doing mantras every day. Like I wake up and I have a mantra the same one that I use every day. A lot of meditations that I read every morning.
Mhm.
um, Stretching, I know that sounds weird but just stretching in the mornings just puts a whole different perspective on my life, because if my body's feeling a little bit more flexible, then my mind kind of goes along with it. And yeah, and just trying to keep a balance.
Mhm.
Like it's really hard to do in this age, to keep a balance. And
Mhm.
even being retired, the first thing I did was I volunteered for everything. Like I just volunteered so much that everything was filled up with volunteer work. And
Mhm.
then after about 4 months, because I was young I was only 61 when I retired. None of my friends were retired. And
Mhm.
so I didn't have anybody to really play with. And my husband's working, he's still working. And so then I realized, oh my God, I'm already burnt out. And now I've just taken on all this new stuff. Like I quit work because of stress. So I've
Yeah.
taken on all this stuff. So I actually saw a friend who became a life coach. She was training to be a life coach.
Mhm.
And we did some great work together for a couple of months. And then I just realized like what I had to let go, what was important, and
Mhm.
to really start making decisions. I mean, I'm still probably far too practical, but learning how to trust my heart and feelings a little bit more.
Mhm.
And
Mhm.
that's really hard to do when especially someone who's been like kind of a control freak forever. So that's helped. I'm still on a journey. I have there are, I have days where, you talked about the track going round and round. Yeah, I have lots of those different ones playing in my head about what I should do or what I shouldn't do, or what it's really what I should do. I should do blah, or I should do blah. And then I feel guilty if I don't do them. So that tape is still there. It comes and it goes. And yeah, the real is the real in the head never really gets totally subsided. It's still it's still going a little bit. Not
Yeah.
as much.
No, that's yeah. No, thank you for sharing all of that. Those are
Yeah.
some really insightful practices that I mean, have clearly helped you, and I'm sure will help a lot of other people. Uh,
Yeah, it's
yeah,
worth a try. It doesn't work for everybody, but all the things I've listed, I've tried other things that like I just won't go back to, and
yeah,
it's whatever works for you. But
yeah,
you don't know unless you try, really.
exactly, exactly. And patience
Yeah.
is a virtue with some of those things for sure.
Yeah, it's not like, "Oh, okay, one session and I'm gonna feel better." No, it doesn't work that way, unfortunately.
No, exactly.
Yeah.
Well, those are all the questions I have for you. Do you
Oh,
have
great.
anything else to add?
No, I think I've talked a fair bit, and I just, for anybody watching this, I would just encourage you to, take that first, find somebody to support you, take that first step, and really, there's great practitioners out there, and there needs to be more. Um, and it's hard, but you can get through it. So I've persevered, and other people can do it, and I know lots of other people in my life that have had a lot of traumas, and they're making their way. So that's those are my some of my last words, I think.
Thank you so much, Shirley, for joining
You're
us
welcome.
on Break the
Okay,
Stigma and sharing your unique story and all your insights.
thank you.
Thank you.